Why do you need to measure the pulse? There is a common misconception that pulse is just a measurement of heart rate. No, there are more than one reason we should measure the pulse very carefully. You see, there are few important points that must be remembered. One is the rate, rhythm, volume, condition of the arterial wall, tensions, inequality among the different palpable area of the inequality of the pulse in different limbs, for example upper limbs, lower limbs, or both limbs, as well as there are abnormal pulses are also there, like the pulsus bisferiens, pulsus bigeminans. So let's discuss one by one. So what about the rate? We know there is a standard heart rate for adult, for example, is 60 to 80. If it is beyond the 80, we must know what are this condition is called tachycardia, and there are some reasons, physiological reasons. Suppose you have run for a short distance, suppose bus, you have to pick up a bus, running bus, so you run faster, so in that case the heart rate increases. So that are physiological cause of tachycardia. There may be a pathological cause of tachycardia also, for example in high fever, in hyperthyroidism there are tachycardia. Bradycardia is also, bradycardia is called when the pulse rate comes below 60, and there are some physiological reasons. For a trained athlete, they have a low pulse rate, that is normal, but there are some other conditions like the different degree of heart block, you will get bradycardia. Regarding the rhythm, you must know that heart beats at a regular interval, at a regular rhythm. So ectopic beats may be present in some disease heart. Some heart beats at a very irregular way. For example, if you have a atrial fibrillation, so here the heart beats in a very irregular way. So that can be detected in you by proper measurements of the pulse. Volume of the pulse is very important. For example, you have a very low volume pulse is seen in case of a cardiogenic shock or aortic stenosis. High volume pulse is seen in some physiological condition like pregnancy, or in pathological condition like thyrotoxicosis, etc. So high volume pulse and low volume pulse can also be detected by a proper measurement of the pulse. Condition of the arterial wall is very important. Normally we cannot measure the artery, we cannot palpate the artery. Yes, we measure the pulse, but we cannot measure the radial artery. But if you can palpate the radial artery, that means the artery is thickened, mostly due to the arteriosclerosis, and these patients whom you can predict, whom you can detect palpate the artery, that means their arteriosclerosis is there. So these patients are at risk of development of vascular disorder, arteriosclerotic disorder, for example ischemic heart disease or a peripheral vascular disease. So that can also be detected by measuring the pulse. Inequality is a big thing. For example, you have a pulse rate of 80 in one hand and a 77 in the other hand. So in that means there are some inequality. There may be a obstruction or aortitis, or there may be a coarctation of aorta, where that can lead to the inequality of the pulse, not only in the two arms, but also between an upper arm and the upper limb as well as the lower limb. That also can be detected very early. So you don't need to that means you need to measure the pulse in both limbs, actually both upper limbs as well as the lower limb, otherwise you will miss these things. So these are the basic things. There are definitely more than one disease that can also be identified. Different pulse, like the pulsus bisferiens, pulsus bigeminus, that can also, pulsus alternans, that can also be detected by a proper careful measurements of the pulse. So this is the most important topic that all clinicians, all doctors must know. Even healthcare professionals, they must know how to measure pulse, how to measure pulse in a very proper way, and what are the many information that you can get by a proper careful measurements of the pulse. So thank you very much. If you like this video, please try to follow or subscribe my channel. So thank you very much.